Have you ever wondered what happens when your loved one goes to the hospital? Or not just when they go to the hospital, but when they're going to be discharged? Has anyone walked you through that process? Hundreds and thousands of people go to the hospital all the time. But what happens when they actually leave the hospital, and how does that process work when they're not safe to go home? What does that look like? Let's talk about it. Let's walk through literally step-by-step processing between when a patient goes to the hospital, when your loved one goes to the hospital, when they actually go to the hospital, and then they discharge home. What's that process, and where do they go safely in the community if they can't go home? Let's run through it together. All right, so if you're like me, I'm a visual learner. I like to see things. So I figured I talk to patients and families a lot about the process of discharging when they go to the hospital, and I like to break it down. So I was just talking to some of our marketing team, and we were talking about how do you market towards a facility, or how do you market towards a hospital? And I realized, I was like, you know what? I think I need to do a video on the process of a patient going through the hospital, them going to the hospital, and then discharging them home. So I like to draw cartoons every once in a while. Me and my kids, I'll draw them cartoons and we'll color at night. So I figured let's walk you through exactly how a patient goes to the hospital, and then what happens when they discharge safely to the community. So let's run through it together real quick.
Hope you guys are doing good. We're gonna walk through a fake patient. I love the name Betty. I don't know why, but Betty just sticks with everybody, right?
You're playing like Betty White out there.
That's not what your girlfriend said.
Baby, eat a Snickers. Better?
So Miss Betty, cute little Miss Betty. Just fell, fractured her hip, and is now being rushed to the hospital. We're gonna talk about what happens to Miss Betty in that process. It's traumatic, imagining your mom or a loved one fracturing their hip and what happens when they go to the hospital. So Miss Betty, ambulance calls, gets her to the hospital. Now, usually, you're looking at a hospital, you're gonna look at a few different things, right? You've got the ER, and that's where Miss Betty is actually gonna go in and get checked in. Doctor's gonna look at it, see what's going on, possibly need surgery, not sure. But Betty's gonna be in there for a little bit. And based off of the hospital, based off of what happens with that hospital, the patient will be admitted, Miss Betty will be admitted and go onto the floor. In a hospital, you have several different types of floors. Depending on the hospital, you've got something what they call med-surg, right? Something that you call ICU, of course, or step-down ICU. Then you've got an oncology floor and various types of floors, right? So Miss Betty, let's say she has a fracture, doesn't need surgery, but actually just needs to be admitted and monitored. She's getting very weak. They may place her on the med-surg floor. So Betty now is in the med-surg floor. And now imagine this. Betty's son is calling the hospital asking where Betty is. She went from the ER, is admitted now to the med-surg floor. And the son is like, okay, what's happening? The son now goes up to the floor. And now where you're looking at the floor, you've got a few people. This is actually a desk. But you got a few people that are on that floor. You've got, most of the time, the receptionist, right? That's on that floor. Then you've got a team of nurses. So you've got the nurses and the RNs, and then you have the charge nurse, right? And that charge nurse is the one that's in charge of all the RNs that are on that floor. Depending on that floor, you could have anywhere between 1 to 15 rooms, just depending on the floor. Every hospital is different. You've got the RNs that are in charge of that floor, and then on top of that, you've got the charge nurse. Now, you've got doctors that round on each floor, right? And these MDs come in, and they take a look at each patient in each one of those rooms and check up on them and see what's going on. Depending on the hospital too, you've got therapists that float up and down and go between all these floors, physical therapists that go between all these floors and see patients based off of the doctor's orders. So now the son is going to the hospital and saying, hey, where's my mom? Where's everything? How's Miss Betty? Receptionist tell, oh, patients, Miss Betty is in room 405, right? Miss Betty goes in there, it's in there. Now, depending on Betty's insurance, right, the hospital will pick up and cover all of these things, but it all depends on her insurance. Now you're looking at the son and saying, hey, how long are you gonna be here, Mom? What's going on? Are you weak? So now you've got the MDs that are coming in, you've got the charge nurses that are coming in, the nurses that are coming in, the charge nurses all coordinating. Then you got a key person that's also a part of this process. It's called the discharge planner, also known as the MSW, depending on the hospital. Sometimes the case managers act as an MSW. Their job is to make sure that Miss Betty, once discharged, is safe in the community, right? So now imagine Miss Betty. Miss Betty has now been in the hospital for 2 days. Let's see, this rounding doctor comes in and says, hey, I think you're ready to discharge. Maybe she had a couple rounds of physical therapy while there. And then Miss Betty's getting discharged, but not safe enough to go home. Where does Miss Betty go? This is where this key person, the social worker, is very key in coordinating with the team on how Miss Betty's doing at the hospital. The discharge planner's role is really pivotal in the hospital. A lot of pressure on them. They go through a lot to figure out where patients go throughout when they do leave the hospital. The discharge planner then says, okay, Miss Betty, you have a few options. Miss Betty lives by herself. She's probably not safe to go home. Depending on the last physical therapy note, Miss Betty was probably only walking 5 feet and she had maybe weight bearing as tolerated, or maybe she couldn't have non-weight bearing. She had no weight, so she needs more help. The plan now is, okay, Miss Betty, you need to go to what they call a skilled nursing facility or rehab for maybe 1 to 2 weeks, right? That's the option if that was the case. If Miss Betty was good and strong and could do it by herself, discharge planner would say, okay, you need to go home, but you need to have some home health, right? Home health to assist. Maybe nursing comes out a couple times a week, therapy comes out a couple times a week to get them strong and such. Now, all of these areas, right, these other discharge areas, these parts are pivotal, right? Or say, for instance, Miss Betty was actually thinking about not going home anymore and maybe transitioning to an assisted living facility, right, where she pays out of pocket. That's what they call an AL. She would go there, right? So the biggest thing is who pays for all these things, right? The social worker's job is to make sure that the insurance will cover before the patient's discharged to this facility. So Medicare will pick up this stay for a couple of weeks, depending on the area, depending on where you're at in the country. And then after that, on home health, same thing. Now you've got the insurance that Betty has. That insurance, that home health must be contracted with the insurance. If it's Medicare, all home healths that are Medicare certified take Medicare. She'll go home safely, and then she'll get nursing, possibly PT, right, OT. And this is ordered by the MD in the hospital that saw Miss Betty and said she's not safe to go home, right? So these are the options. Now, if you're thinking about this, way before Miss Betty goes to the hospital, as the son, imagine the son now having good information about, okay, Mom just went to the hospital. These are her next steps. Depending on how well she does, she may go directly to a skilled nursing facility for a couple weeks, okay? If she's not strong enough, then she may go home with home health, right? To get her healing, to get her better after the fall, right? So those are kind of the two options that you're looking at. And every area depends, but the most common options you'll see is that when a patient like Miss Betty is discharged from the hospital and she's not fully independent, she's gonna probably need to go to a SNF, skilled nursing facility, or a rehab, or go home on home health. That's usually the case. But in this situation, let's just talk about that in terms of Miss Betty and that fracture. So I hope this helps you. This is just one example. If this helps, we'll do a lot more. But now let's take a look at Betty. Now Betty, let's let's actually have Betty go all the way home. So now Miss Betty goes home in the comfort of her own home. There's no place like home, right? Little chimney, right? Got the windows. Looks pretty nice. Got a little tree, little Bob Ross, little tree here.
See, wiggle it. Other side, son of a gun, it's just, you could shave with it. Look at that. Making the bristles bend slightly downward. See there? Look at that. Isn't that a nice little tree?
Tree here.
And he lives.
Little tree here, right? Miss Betty's at home. So now that Miss Betty's at home, she's home in the comfort of her, she's there at the comfort of her home. Home health is ordered, right? And now home health's goal is to be there for 60 days, right? Or longer, and to make sure that everything that occurred in that hospital, the fracture, the medications that were given, everything that the doctor gave in terms of instructions, the home health is reviewing that and creating a plan of care. So the home health is not going to have the doctor oversee this care. The home health will now work with Miss Betty's PCP, primary care physician, and create a relationship to say, hey, we're going to take care of Miss Betty for 60 days because she just came from the hospital, and this is the plan. And so now at home, the doctor is relieved of Miss Betty because the doctor can only do things within the hospital because it's a hospitalist or a doctor. They'll refer out, and then once they get into the community, the PCP of Miss Betty will pick up and the home health will coordinate with the PCP. So fast forward, Miss Betty's doing good, fracture's healed, and she can go to her grandson's graduation. Doesn't that sound like a good, that sounds like a good one, right? Good situation, so. All right, yeah, so that's it. That's Miss Betty in a nutshell. We hope this helps you. If it helped you, please like and subscribe. Join our YouTube community, and we'll see you next time. We maybe have another situation where Betty maybe has CHF and maybe it goes a different route. We'll talk about that next time. All right, see you guys next time.